I'm the founder of Black Women Cultivating Change. We were blessed with a sponsorship from the American Heart Association to host this event today because we have a disparity in our community when it comes to heart health. We would like to introduce Dr. Florence Rothenberg. She's going to do the welcome for you guys. She is an amazing cardiologist. She works at the VA hospital, but she is so passionate about cardiovascular health that she opened up this center. So this place is actually Dr. Florence Rothenberg's community space. And so she wants to improve the heart health here in this neighborhood, but I'm going to turn it over to her and she's going to share some statistics with you all and some history on why she did it. So thank you so much.
My name is Florence Rothenberg. I've been a cardiologist at the VA now for almost 20 years. I could see very early on in my career that there was a very different outcomes for patients who had access to healthy food and exercise and those who didn't. Cardiovascular disease is the #1 killer of men and women, and it affects all races, everyone equally. There are 48 neighborhoods in Cincinnati, and the difference in the lifespan of people in those 48 neighborhoods is 25 years depending on your zip code.
I'm so glad you can join us today for this important discussion on advances and challenges in valve disease care. Again, my name is Erica, and I'll be serving as your moderator for this session. Today, we're bringing together an incredible panel of experts to unpack and not just where we've been in valve disease management, but also where we're headed.
What works for one person at one age may not be the best option for someone at another age, and just to dovetail on what Dr. Juan said, it really is important to see your primary care doctor early and often, and just make sure you're getting those screening tests because those things often tend to detect larger issues.
The symptoms, like even if it's the smallest symptom that you may pass off as, I'm just off today. Have those conversations with your primary care provider or your women's health provider and say, hey, I'm experiencing, dizziness, or I'm having some shortness of breath when I'm doing X, Y, Z. It may not be cardio stuff, but it's still good to make sure that you're having that conversation so we as primary care providers can keep track of those things and then we can refer appropriately.
And even here, come in and have some screening. Places like this, take your blood pressure and they find out, well, your pressure is very high. Have you ever been evaluated? No, never. I didn't know. So then you can start this.
So now you're experiencing back up into your body. Now you're experiencing the shortness of breath, the swelling, things you may have attributed to, I just ate a little too many potato chips yesterday. So please, those small symptoms, don't ignore it. Also, don't just write it off as, oh, my mom had these issues, so I'm gonna have these issues. Again, those are things in our community, I feel, as we're bringing to the forefront today, are important to capitalize on.
Maybe expand a little more and walk us through what the conversation with the patient might look like when weighing these options.
The way we're doing surgery is different from surgery that we were performing years ago. We now do surgery minimally invasive or endoscopic. We do it with a small incision. We put a camera in your chest, and we don't have to open the chest all the way. Patients go home after 3 days. So a lot of the times, there are different technologies that allow us to really look into that moderate arena and say, well, maybe it's more than moderate. Maybe she needs surgery. So those are things that are important. Just make sure that you follow up with your physician.
Think to yourself that, oh, I'm too old to do surgery. Maybe not, because in reality, it is a small part of a lot of different factors that we think about when we make decisions to do surgery on someone.
Younger patients are like, there's no way I'm having, cardiac issues. And so when you see me, some of my immediate questions are you having shortness of breath, wheezing, chest pain, heart palpitations? Are you having swelling in the ankles or the feet? Are you having dizziness? Are you having syncope episodes? Those are some of just the run-of-the-mill questions that are going to tick me off to, are we dealing with something bigger?
And again, when we're at the doctor's office, as was mentioned, bring someone with you. Bring an advocate, bring someone that can take notes, because most times we're gonna have some shock factor if we find out we have newly formed diseases or something that we're combating. So really be your own advocate as well, but be willing to educate yourself. Bring the tools that you need to make sure that you're doing your own research, and bring those questions to your doctor. Don't be afraid to ask questions. I think sometimes we get to where we trust every single thing that is said, but it's our part to understand what is said.
We go and oil change. We do it all the time. It's the same thing with our bodies. We gotta do this. We gotta go and see the PCP. We gotta see the cardiologist. We gotta see the surgeons and make sure that the valve we got continues to work well.
Have a primary care doctor you haven't seen in 5 years, you're like, I don't even know, is it worth it? They're gonna tell me all these things are wrong. Maybe they are, maybe they aren't, but the one thing you have to do is just to start.
At the end of the day, heart valve disease doesn't discriminate. However, there are still very much issues with access to care.
Don't be afraid to share your story with others. You never know how your testimony may help someone else through a difficult situation.
And what innovations in valve repair or replacement therapies are you most excited about, and how they might reshape standard practice in the next 5 to 10 years?
AI. I'm always excited about AI because it's so amazing. It is going to really niche down and really tailor care to specific patients instead of a, one size fits all.
So, from you all's perspective, what are the biggest barriers patients face in recognizing symptoms, accessing diagnoses, and getting timely treatment for valve disease?
I remember I had a heart attack at 40 years old, and I had plenty of symptoms before it actually happened. And I would say, oh, that happens when I eat too much pork, so I'll stop eating pork for a little bit. Or, like I said, shortness of breath. Oh, I need to lose weight. And then I'll stop eating for a while. In my mind, I think I'll feel better. But I had a whole history of my family having heart disease.
Kind of my hope is that we get people to start taking their blood pressure early and often.
One of the initiatives that I've been doing is called Barbershop Beauty Salon Talk Series. And so we go into barbershops, beauty salons, and have candid conversations around heart health, kidney health, and what that looks like.
Some of the cardiovascular issues don't hurt, and that doesn't, and people don't go to the doctor for that. Like your valve issues, you're not going to feel that. Your hypertension, you don't feel that. You have to check it. Some of those diagnostic things, they aren't cheap. Like money's an issue, transportation is an issue, taking off work to go to the doctor is an issue. We need a way to get patients to the care, to the tests that they need.
Every community in all of our 52 neighborhoods, there is a community council. Be a part of your community council.
No one's gonna remember me talking to them about blood pressure, but they'll remember their friend that came back and told them, right? It's that trusted individual, your sister, your mother, your cousin, having, like, I went to this event and I took my blood pressure and it was high, and then I went to the doctor and found out I had hypertension. You should go to the doctor. Or when's the last time you took your blood pressure?
We have to take the information back within our own community, right? Educate our own community. We need to advocate for our own selves.
What role do lived experiences play in shaping treatment plans and care models, and how can healthcare systems more effectively incorporate patient and caregiver voices?
All the things like community advisory boards, another plug for the survey, filling out surveys, participating in research. All of those things really help improve care, and we don't know what we don't know.
Just things that I noticed as a patient that they don't see because they're not the patient, and they actually live to their patients. So I've seen, since I've been with the Christ Hospital, things that have changed due to patient concerns, and then they've actually heard us.
It's important that you get out and advocate, use your voice, speak to the clinicians. Clinicians want to speak to you, get everyone together and move forward. Because really, it's your voice. You have to advocate for yourself.
Black people have the highest rates of hypertension, as we all know. Kind of something that Sonia mentioned on the last panel, we're also underrepresented in clinical trials for valve disease treatments. How does this impact care, and how do we change it?
Until 31 years ago, every study, every clinical treatment, every trial was performed on women, but was made for men. participating in clinical research is how we are going to improve care for us. Ask the questions early and often, and just really understand that, you know, it could not benefit you, but someone in the future.
Most medication that we take are made for the average white male because we don't participate in trials, right? And so if we're not represented in these clinical trials, there's no way of them knowing what to make for us.
Sandra A. Wright is a thriving heart survivor, community health awareness advocate, and a founder and executive director of the Right Life Wellness, which is a 501c3 nonprofit promoting healthy lifestyles and self-care.
I started the Right Life Wellness 8 years ago, and I've been running this organization single-handedly as a heart transplant patient. Now, I learned in my early 30s that I had an irregular heartbeat. When things happen to us, the first thing we want to do is keep it on the down low. On the eve of my 58th birthday, and they come into the hospital room to tell me that I have congestive heart failure. We know our bodies. Doctors know medicine. And you must tell them what's going on with you. Even if you can't articulate it, your body will give you warnings. Don't do what I did. Learn from what others get up to share. There's no age gaps, no age barriers, there's no ethnic, there's nothing. Heart disease will attack any and everyone, including children. Get the screenings. Follow the instruction. Ask your questions. Educate yourself. You have to be proactive. The information that was here on this stage is priceless. I'm dealing with challenges, health challenges, right now. Serious. But do I look like it? Because I told you, don't play about Sandra. And I would like to have more community involvement with these beautiful organizations that's sitting out here, because I can no longer do this alone. And the beautiful thing about all of this, we get more done how? Together.